Thank you, Jerome, and welcome everyone to the Markey Cancer Center Affiliate Network's COVID-19 and Cancer web series. Most of our programming is developed and offered exclusively for our McCann members. However, due to the emergent nature of COVID-19, we have opened the web series to those outside the network. So if you're new to our McCann educational programming, we're very glad you're here. As Jerome mentioned, today's webcast is the economic impact of COVID-19. While state social distancing orders appear to have slowed the spread of COVID-19, they have also had a very costly economic impact. And early data suggests that the nation could experience its largest employment losses since the Great Depression. To help us understand the economic impact of the COVID-19 pandemic, I'm delighted to introduce Dr. Michael Clark. Dr. Clark is an associate professor and interim director of the Center for Business and Economic Research in the Gatton College of Business and Economics at the University of Kentucky. Prior to coming to UK, Dr. Clark was the chief economist for the Kentucky Legislative Research Commission. He conducts applied economic and policy research focusing on labor, health, and economic development issues. Welcome, Michael, and thank you for sharing your time and expertise with us. And I will turn things over to you.
Well, thank you very much. I appreciate your time today. And let me switch over so you can see my slides. The first thing I wanted to do is, for those of you who maybe aren't familiar with the Center for Business and Economic Research, is just give you a little bit of sense of what we do. We are within the Gatton College of Business and Economics, and basically what we are is we're an applied research center. We do a lot of work for different types of organizations, primarily state and local governments, but we also work with business associations and private organizations. And we do applied research and forecasting. And generally the idea for us is that we're trying to use the economic research to help business leaders and policymakers make more informed decisions. So that's kind of our goal and what we spend our time doing. I want to start off with just a bit of an overview as we start talking about how COVID-19 has been affecting the economy. So there's three basic questions that I'm going to try to address today. First is, we keep hearing a lot about the economic downturn and just how bad it is. So one is, I want to kind of show you exactly what this looks like, put it in perspective as best I can. We're also going to zero in on some of the major industries that are being affected, because while all industries are certainly being affected, they're being affected in a very different way. So I'll give you some information on that. And then finally, I want to talk a little bit about what a recovery could potentially look like. Kind of what people are thinking, what economists are thinking is likely to be occurring over the next few quarters as hopefully we see the economy start to recover. I do want to issue kind of a couple of caveats that really apply to the entire scope of the presentation. And that's the first one is that the situation is really continuing to evolve, and it's really evolving at a very rapid pace. So as we talk about this, as I've been talking about this to different groups and the media, one of the things that we've really run into is, as it has developed so quickly, a lot of our initial assessments have really changed as we've gained more information. The other thing is that we're now starting to get to the point where we're starting to get some data just showing how the economy has been affected. But it's really important to understand that the data that we have is preliminary. It's some of our first glimpses at how the economy is being affected, but the initial data tends to be preliminary, and it's often subject to revision. So again, we may have to kind of consider, as more information comes in, how this is affecting the economy and change maybe our assessment. Okay, so let's talk a little bit about what recessions really are and whether we are potentially in one at this point. So there's a common definition of recessions that you hear in the media a lot, and that's that a recession is when you have 2 quarters decline in GDP. Now, GDP is gross domestic product. It's basically the dollar value of the goods and services that an economy produces. So the common definition, which is actually not really correct, is 2 quarters decline in GDP. Now, in actuality, whether we are in a recession or not is determined by the National Bureau of Economic Research. And this is a group of primarily academic economists professional economists. And what they do is they have a group that evaluates the economic data and sees whether or not we've seen diminished economic activity. And they look at a number of different indicators for this. GDP is one of those, but they also look at data on employment and earnings and various other factors as they look at this. And it's really not a rule of 2 quarters. The idea is, have we seen some kind of an indication in the data that the expansion that we had been in has actually stopped and we're in a contraction? Now, they don't actually make this determination until sufficient data is available. So, are we in a recession? Well, we probably are, but no official determination of that has been made. And in fact, it might actually be several months before the NBR finally makes a determination as to whether we are in a recession or not. So we're still waiting to see, but this certainly is a significant downturn, regardless of whether it's finally labeled as a recession or not. All right, so when we start looking at the different types of economic indicators, the big ones are GDP, gross domestic product, and employment. And we're going to spend a fair amount of time talking about that. Let's start off talking about US GDP. Here we see the percent change in US GDP. We're looking at real GDP. And when I say real GDP, what I simply mean is that we've removed the effects of inflation from there. We're wanting to see how the value of the goods and services, or the amount of the goods and services that we produce, are changing over time. And so you can see, how that has looked, for several years, and how GDP actually changed during the last recession. And of course, the last recession was a pretty significant economic downturn. And you can see in one quarter there, we had a decline of greater than 8%. But again, it was several quarters of a decline. But then once the recession ended, we started seeing fairly consistent growth for the next decade, really a little bit more than the next decade. Occasionally, we see these decreases in GDP, but they've not been persistent. And even over the last couple of years, what we've actually seen is very consistent growth in GDP until last quarter. So last quarter, what we saw is that GDP, we look at the percent change in an annual rate, declined 4.8%. And it's important when we put that in context to remember that up until early March, the economy was actually running fairly well. Both January and February, the economy was doing well. A lot of the trade concerns were starting to ease. And so, it was actually, the economy was actually looking really good. Much of the decline that we saw really occurred towards the last part of March. And even with just that limited exposure in terms of that quarter, there was a pretty significant decline in GDP. I also want to show you how GDP looks for the nation relative to Kentucky. And mainly what I want to do here is show that Kentucky's economy tends to be highly correlated with the national economy. So of course, different scales here. The green represents US and it's in trillions. The blue is Kentucky and is in billions. And again, both are representing the value of the goods and services that are being produced. But you can see that generally, as the national economy tends to grow, we tend to grow along with it. We have a little bit more variability, which is fairly common for a state. But also when the national economy goes into a recession, as we did in 2008, Kentucky tends to follow through with that. We also, we might see it at a little bit of a lag, as we did in this data. But the point here is that Kentucky's economy is highly correlated with the national economy. So, we tend to move with it. All right, let's start talking a little bit about the labor market. And the media has been doing a pretty good job of covering unemployment insurance claims and the employment numbers. Well, I want to take you through some of these numbers as well, maybe give you a little bit more context for exactly what they mean and maybe what they don't mean. So one of the most timely sources of data that we have on the economy are weekly unemployment insurance claims. They are a leading indicator of how the economy is doing. And we have two different measures. We have what's called initial claims and we have continued claims. Now with initial claims, the idea is that if somebody loses their job, They call up the Office of the Unemployment Insurance and they file a claim. They go through a process where the state determines whether or not they're actually eligible to receive unemployment insurance benefits. Some, turns out, are not. And then once they have their claim has been approved, they have to continue to submit claims. That's these continued claims. And these basically are an indication of the individual's employment situation hasn't improved. They're still unemployed. And so they're continuing to need support from unemployment insurance program. So when you look at these two numbers, initial claims tends to be kind of the first thing that we see changing. Now those numbers tend to be lower because what happens with cumulative or continued claims is they tend to accumulate, right? So as each week more and more people file a new claim, you have more and more people filing continued claims, whereas the initial claims are just representing those new cases in a particular week. And so you can see if you go back to 2008 when the recession occurred, we actually started seeing a pretty big increase in unemployment claims. And really for Kentucky, you know, it jumped up at the beginning of the recession, and then really about halfway through the recession is where we really started seeing some big increases. But as the economy improved, we started seeing that situation, people going back to work, they weren't needing unemployment insurance claims or unemployment insurance as much, and so that was gradually declining again until March. So in March, we see a big spike in claims, both continued claims and initial claims. Now, part of that is really due to some policy choices. In the past, unemployment insurance was really available for only certain types of workers. Now, most workers are covered by unemployment insurance, but independent contractors are not covered. And it's really only, you're only eligible if you have actually lost your job. But some policy changes have actually opened that up to a lot of different types of workers, which is part of what's going on with that spike. We are certainly seeing a lot of people being affected by this, but it's also partially reflecting these policy choices. I want to zero in a little bit more on the past few weeks and show kind of what that spike has looked like, because you couldn't really see it in that previous graph. So here we have initial claims, and we're seeing it by each week. And prior to the order to start restricting the different types of businesses that could safely operate, claims were running around, initial claims were running around 2,000, 3,000 claims per week. When the order started, we started seeing that jump up, and it was regularly exceeding 100,000. But now we started to see that decline a little bit. We're still seeing a lot of claims coming in, certainly much more than what we had before. But we are starting to see that gradually come down a bit. Continued claims, which is probably a better indication of how many people are actually affected, grew as well, reflecting all these individuals starting to sign up for unemployment insurance. But it seems to have leveled out. Now, going forward, it's not entirely clear exactly how this is going to continue. I wouldn't be too surprised to see initial claims maybe start to spike up a little bit, maybe in later months, particularly as the payroll protection starts to wind down. And continued claims, I think, are a pretty important indicator in that, what we're seeing there right now is that things maybe seem to be stabilizing in terms of it not getting worse. But that's a number that will really be important as we go forward to watch. As we start seeing it starting to decline, it's going to be maybe an indication that not only are people not losing their jobs, maybe people are starting to go back to work. So here what I'm showing is I'm using continued claims, and I'm showing them as a percent of the workers who are covered by unemployment insurance. Now, this is referred to as the insured unemployment rate. This is not the headline unemployment insurance or unemployment rate that we normally hear about. I'll talk about that in just a minute. This is a little bit different of a measure, and it's, again, based on these continued claims. And the main thing I'm wanting to do here is I'm wanting to show how our continued claims here in Kentucky are comparing to the US. And part of my motivation for doing this is that there's been a lot of headlines where basically people have been taking the initial claims and totaling those up and showing those as a percentage of maybe the labor force. And when you total those up, it looks like about over 700,000 workers in Kentucky could potentially be affected by this downturn. And I'm a little bit concerned about that interpretation because not all of those people who file claims will necessarily find that they are eligible. I'm not entirely convinced that there isn't some duplicate counts in there. But if you use those numbers, it would suggest about 40% of the workforce has actually been affected. And I'm kind of thinking that might be a little high. And when you compare our number in Kentucky, when you do that relative to the rest of the U.S., we look really high the rest of all the states. But when you look at continued claims, we actually seem to be fairly in line with the rest of the United States. We're about the middle of the pack in terms of states, and we're right in line with the rest, or with the nation as a whole. The other thing that I would kind of caution on this is that there have been some processing issues associated with the claims. And so it's possible that when we look at continued claims, if there is a backlog of claims, that maybe that starts to grow a little bit. And so we do have to kind of watch for that and what that could potentially signal. Okay, let's talk a little bit about how different sectors have been affected in terms of these claims. And here you're going to see data sorted out by what sector did the claim come from. So when a worker files a claim, what sector were they working in? And so what we're seeing is, again, that spike in initial claims. And these are the sectors that have been primarily affected by the orders to restrict some of their businesses. And so you can see that, retail trade, accommodations and food service, healthcare, and we lump healthcare in with social assistance, but it's mostly healthcare, and manufacturing. And these are all sectors where there is some fairly close proximity to people. And so these were the ones where largely orders were, governors were issuing orders to restrict how the business operated. And so these were some of those that were shut down early on. And of course, manufacturers, they were also seeing that, there's the potential for spreading the virus within manufacturing plants due to the close proximity of workers, and also with their demand for some of their products declining, they were starting to shut down temporarily. As they do this, their workers are able to apply for unemployment insurance. But again, we saw several weeks where this was relatively high, but this seems to be tapering off a little bit. All right, the unemployment insurance rate that we normally hear about, what's typically reported in the news, is basically comes from a survey, and we do the same survey across the entire U.S. And it provides a much broader indication of how people are affected. But again, there's some concerns about how we might use this. Kentucky and the U.S. have actually been moving relatively similarly. We've generally had a higher unemployment rate in Kentucky than in the rest of the U.S. When our latest measure came out this morning, Kentucky was at 15.4% unemployment rate, and the U.S. was at 14.7%. I want to talk a little bit about what exactly this number means and how it actually moves, because while the unemployment rate is a common statistic for us to use, there are some things that we've got to be aware of when we're interpreting it. Now, the unemployment rate is actually determined by the number of people who are unemployed divided by the labor force. Now, the labor force is all the people who are working plus anybody who is not working and searching for work, or the people who are unemployed. So unemployed people, they either have to be without work, and they have to actively be looking for work. If you're not looking for work, you're not counted as unemployed, and you're also not counted in the labor force. So let's look at how some of these numbers have changed over time. So here's our unemployment rate again. This is all Kentucky data. The red line is showing the number of people who are actually employed. The green line is showing the labor force. So it's the number of people who are either employed or unemployed and actively looking for work. Again, if you're not looking for work, you might want to go back, but in the official statistics, you are not counted as being unemployed and not in the labor force. So if you look at some of these numbers, what you can see is that Kentucky, since the last recession, they saw the unemployment rate declining over time. Now, this actually occurred for a couple of different reasons. If you follow this red line up from about 2010 to around 2013, what you are seeing is that the number of people who were working was actually going up during this time period. The labor force during this time period was relatively constant. So the gap between those, which is the number of people who are unemployed, was declining. So the unemployment rate was actually declining in this period because people were going back to work. But over the next few years, from 14 to about 16, what was happening is that fewer people were working, but people were leaving the labor force. What was happening there is that unemployment insurance benefits that had been expanded for the last recession were starting to run out. Now, to be eligible for unemployment insurance benefits, typically you have to be searching for work. So when those benefits ran out, these were discouraged workers who had been unemployed for a long period of time. They simply stopped looking for work. They simply left the labor force. Now, if you look at the unemployment rate, that actually went down, and it looks like, just looking at the unemployment rate, well, that must be a good thing, right? The unemployment rate went down. Well, in fact, in this period of time, it's not, because we actually had fewer people working. Now, since then, we started seeing employment grow until, again, about March. And with March and April, the number of people who were working declined substantially. And that has caused the unemployment rate to jump up quite a bit. As you're monitoring the economy, the unemployment rate is a good number, but really this red line, joint employment, I think is probably a better indication of how we're doing. Okay, I want to talk about a different measure of employment. So the previous one, we were counting people. How many people were working? How many people were unemployed? Our other employment number is basically counting jobs. And so this comes when we survey businesses and we ask them, how many people do you have working for you in a particular week? And so this is a count of jobs rather than people, because somebody can be employed in multiple jobs, and so they would be counted twice. But again, we see the same type of decline here. So with employment, what we saw, if you go from March to April, we saw about a 15% decrease in what's called payroll employment. Now, this doesn't cover agricultural jobs. It doesn't cover people who are self-employed. It's just non-farm payroll employment. But if you look at that relative to this entire series, what you see is that our decline in employment has been significant, and we have significantly fewer jobs than what we had even at the worst of the last recession. So definitely a sizable impact in terms of the economic downturn. All right, so I want to start talking a little bit about employment across different sectors. Now, this data is all pre-COVID-19. So this is from 2019. And the reason I show this is because I want to provide a little bit of an indication of how dependent Kentucky is on each of these different sectors. Also, I want to show it relative to the US. So what you're seeing there is the number of jobs are for Kentucky, but you can also see the share that each sector makes up of Kentucky's total non-farm employment. And so a couple of things to notice is that there are about 6 sectors that are relatively large for Kentucky. Trade, transportation, utilities, government, of course, is a pretty big one. Education, health services, again, that's mostly healthcare, manufacturing, professional business, and leisure and hospitality. These are kind of our big sectors. The other thing that I want you to note about this is that these are often sectors, or many of these are sectors, where people have to come in close proximity to one another. And so they, not only do we have relatively large sectors, but these relatively large sectors are those that are most at risk of potentially spreading the virus. And so as we start looking at imposing restrictions to contain the virus, these are the ones that are most at risk of seeing some employment losses. The other thing I want to point out is that when you look at some of these, Kentucky has a little bit more exposure than the rest of the nation. Now, with leisure and hospitality, certainly that's one where there's, it's been hard hit. Kentucky doesn't have a whole lot more leisure and hospitality jobs than the rest of the nation. Actually, we have a little bit less, but it's pretty much in line. Same thing in terms of government jobs. Retail trade, which is the part of trade, transportation, utilities, the retail stores, we're about the same as the rest of the nation, about 10, 11%. But with manufacturing is one where we have a lot more exposure. And so a lot of manufacturing plants were starting to close down in response to concerns about spreading the virus. And manufacturing jobs account for 13% of Kentucky's economy, much more than the rest of the US. So when we start thinking about how Kentucky's economy is impacted relative to the rest of the nation, that's one that really stands out as one where maybe we have a bit more exposure than the rest of the country. All right. So how has employment changed across each of these different sectors? So here what I'm showing is a percent change in employment from February to April. And I'm going back to February rather than March because I want to show prior to some of the restrictions on these businesses. And if you look at that top number, non-farm employment, you see for Kentucky, we lost about, from that 2-month period, we lost close to 16% of the jobs. A bit higher than the rest of the U.S., but still kind of in line with the U.S. at 14%. But then you can start to see across all these individual sectors where we've been affected. Now, mining and logging we have a big difference, but that's a relatively small sector in terms of the count of employment. So it's significant for that sector, but it hasn't made a huge impact in terms of the difference between Kentucky's losses in total and the U.S. Manufacturing, though, you see that our manufacturing sector went down by about 22%. And so that was pretty significant. And that's largely because of the exposure that we have in terms of the types of manufacturing that we do, but also in terms of the fact that, we've maybe made some different policy choices that made it a little bit easier for some of the manufacturers to go ahead and shut down their businesses in response to COVID, in terms of making it easier for their workers to apply for unemployment insurance. In terms of trade, transportation, utilities, retail trade is in there, and that's the big one that was affected. We're pretty much in line with the rest of the nation there. And when you look at health services, we've been affected a little bit more. Again, health services is the bulk of that education and health services sector, but we've seen a few more losses than the rest of the nation in terms of percentage of our percent change. I want to focus on a couple of these specific sectors and show you kind of the long-term trend so you can see how these decreases kind of compare to what we've seen in the past recession. So here we have trade, transportation, utilities, manufacturing, professional and business services. And again, what you're seeing across all these is these significant declines. And when you look at them relative to the losses in the past recession, these declines were sudden and significant. Each of these sectors, well, the manufacturing and trade, transportation, utilities, the declines are larger than what we saw during the Great Recession. The other thing that I would point out to you is kind of look at what happened during these recessions. So the recessions are marked by these blue areas. Employment declines in all of these, right? I'm going to use this here just a little bit. I want to show how it's different in healthcare, which may be of particular interest to this audience. But if you'll notice that there's been declines during all these recessions for all these different sectors. Retail trade and leisure and hospitality are the major sectors that have been affected by some of the restrictions on what businesses can operate. Again, these have seen very large decreases for leisure and hospitality. These declines are huge. Nationally, we lost close to half of the jobs associated with leisure and hospitality. So this sector has been hit significantly. All right, healthcare and social assistance. People often ask, is this recession different? And it really is. If you look at healthcare over the long period of time, it's like healthcare never experienced a recession. I mean, I know that's a bit of an exaggeration, but in terms of employment data, if you look at what's happening during the recessions, the healthcare sector continued hiring workers during this time period. They continued to expand. The only decline that we saw really was around 2014, but that didn't last terribly long, and we saw hiring continue again until March. So one of the big differences in terms of this recession versus others is how it's come about and how it's affected different sectors. The impact on the healthcare industry has been significant, as healthcare workers have both had to wrestle with the fact that close proximity makes them a little bit more at risk of potentially spreading the virus. And the other thing that I'm hearing, of course, is the issue of personal protective equipment. The shortages of those have caused healthcare providers to kind of allocate those to areas where maybe it's a little bit more crucial. So as different healthcare sectors, different types of offices have shut down, we have seen the healthcare sector employment decline substantially. Now, we don't have detailed data at the state level on this sector, but we do have some detailed data nationally for healthcare employment. And so we can look at which types of healthcare offices have been particularly affected. And nationally, what we saw is that employment declined by about 8.9% in healthcare. Most of that decline really showed up in terms of ambulatory healthcare. And it's these offices, physicians' offices, dental offices in particularly. About half of the employment was gone for April relative to what it was prior to COVID-19. For other healthcare practitioners, this would be things like podiatrists, chiropractors, different types of medical healthcare practitioners. They all saw significant declines. Now, a lot of these are going to come back as these offices start to reopen. So we do anticipate that there is going to be a bit of a jump as restrictions have been lifted, as some of these offices start to understand how they can reopen and start to get some of their patients back. Okay, what kind of change from employment to talk a little bit about consumer sentiment, because consumer sentiment is going to be key during the recovery. Consumer sentiment is measured by a survey that the University of Michigan does. It's a national number, and it gives us just a sense of how do consumers think the economy is going to perform over the next few months. And so what you can see is that consumer confidence, it varies quite a bit from month to month. But of course, with all the things that are going on, consumer sentiment has declined quite a bit. Not quite as low as it was during the recession, or at least the worst of the recession, but still a significant drop-off in consumer confidence, which suggests that consumers are very concerned about maybe their employment situation, their wages, and so that may cause them to be a little bit reluctant to spend as we start trying to work our way into a recovery. All right, so let's talk a few minutes about recovery. And the first thing I want to do is kind of preface this with, this is really uncertain at this point. I'm going to talk in some general terms. So when we say this economy, or this downturn has been different, it really has been, because when we think about recessions, usually recessions are caused by some type of a shock. So what happens is maybe there's an oil shock, or in the case of the last one, there is a financial shock that causes consumers to reduce their demand for goods and services. And it takes a while for that to kind of work out. Consumers kind of get more confident that their jobs are secure and for spending to pick back up. This current downturn was really a policy choice. It was a policy choice to restrict different types of businesses that could operate in an attempt to address a public health threat. So we start thinking about what a recovery will look like. A recovery is really going to be determined by a number of factors. We think we've probably reached the peak of social distancing policies. And so as we start easing those policies, allowing people to kind of come back to their normal behaviors, as we start allowing businesses to reopen, that is going to start the cycle of the recovery. But it's really going to have to be associated with how well can we manage these reopenings. Are we able to do reopenings in a way that keeps the virus from spreading? And if we're not able to do that, it's possible that some of these social distancing policies could come back on, which could interrupt any kind of a recovery that we might be expecting. The other thing is the behavior of the virus itself. We still don't understand this. I can't really speak a whole lot about this, but again, my understanding is that we're still learning how this virus behaves, and so we don't really know whether there could be a second wave or not. But certainly, the behavior of the virus is going to dictate whether there are some additional social distancing policies that are needed in the future. The other thing which I've touched on a little bit is consumer confidence. As I've mentioned, consumer confidence has been shaken quite a bit. And even as these restrictions are lifted, I think there's still so much uncertainty associated with how the economy is going to perform over the next few months and the behavior of the virus, that consumers are going to be a little bit reluctant to return to the usual spending patterns. We'll certainly see some people returning to their spending patterns. I know retail stores have started to reopen. We're starting to see more people venture out there, but I still think a lot of consumers are going to be a little bit reluctant going forward. I particularly think purchases of big ticket items, which really help drive a lot of the economic activity, such as houses and purchasing automobiles, are probably going to be slow until consumers feel like the recovery is really on solid ground, and that we won't be interrupted again, and that we won't start to have more risk of unemployment, and threats to our income and wages. So again, this path of recovery that we're looking at is really highly uncertain. So, something that we're going to have to watch, something that we're going to have to kind of modify our expectations as we go forward. I do want to provide, show you some information that recently came out from the Congressional Budget Office. They did a forecast, and they just released it a couple of days ago, but it gives you an idea of what recovery could potentially look like over the next few quarters and into next year. What this graph is basically showing is output, how much goods and services are being produced. And what they've done is they've basically benchmarked this chart to the fourth quarter of 2019. And they're showing how output is going to compare to the output level that we had in that fourth quarter of 19. And so it gives you a really good indication of kind of how far we're declining, or we've declined in each quarter, and how quickly we're coming back. And what you'll see is people are talking about recessions and kind of like, is it going to be a V? Is it going to be a U? Is it going to be a W? Well, the idea behind these is to get a sense of how quickly is it going to come back. A V-shaped recovery is one that drops off dramatically and then it jumps back up quickly. Well, none of those letters really seems to fit the situation that we currently have. We have this dramatic decline. We are going to start to see your Congressional Budget Office, or CBO, is expecting that there's going to be this kind of bounce back up as we start to reopen. But then it's going to be kind of gradual after that. And if you look out even into the fourth quarter of 2020, and these are our calendar years, that even into the fourth quarter of 2021, we are still looking at an output level that is going to be below where we were at the end of 2019. Now, again, there is a lot of uncertainty associated with this, but the CBO's expectations of how we're going to proceed seem to be fairly much in line with a lot of professional forecasters. And so this provides us, I think, a pretty reasonable kind of set of expectations, with the understanding that, again, a lot of uncertainty, a lot is going to change, and as we get more data, all these projections are likely to be revised over the next few quarters. All right, Congressional Budget Office has also provided estimate of the employment, and basically it's showing kind of the same thing. It's showing how employment is changing relative to where we were nationally in the fourth quarter of 2019. Again, large decline in employment in the second quarter, which is where we're at right now. they see employment coming back a little bit slower in terms of relative to output. But again, we really start to see towards the end of the year, employment start to coming back. So as these bar charts get smaller, what it's basically saying is that we're starting to see workers coming back. People are hiring, or businesses are hiring, and so workers are going back to work. But again, even in the fourth quarter of 2021, we're still not seeing employment levels projected to reach where we were at the end of 2019. Well, as we look at this recovery, there's still a lot of challenges, and I suspect that a lot of you are wrestling with these issues as well. Certainly limited childcare as we start to open these businesses. A lot of families need some form of childcare to be able to go back to work, so that might make it harder for some of these workers to come back to their jobs. Manufacturing firms in particular have seen their supply chain substantially disrupted. And so a lot of the inputs that maybe they had been using before maybe are not available, as some of their suppliers are still wrestling with how to pull out of this downturn. And then generally just there's significant reduced demand, and there's a lot of uncertainty associated with the demand going forward. So it's really not clear exactly how this is going to proceed. We do think it's going to start to pick up, but there's still a lot of concern here about what level of demand that these firms, particularly these manufacturers, can expect over the next few quarters. Another issue that we really have to be concerned about is how long does it take for this reopening to actually occur? We're seeing with this closure, a lot of businesses have shut down, and we're starting to hear more and more about businesses that are going out of business. The longer it takes for them to reopen, the more we're going to see that they've exhausted any financial resources that they may have had. Certainly there have been some policy choices from Congress that has helped support a lot of these businesses and maybe give them a better chance of staying open until the economy starts to reopen and businesses start to improve. But the longer this takes to really take hold and for businesses to return, we're going to start to see more and more of those businesses maybe closing permanently. The other issue is, we have these employer-employee relationships. When these businesses close down, the employers and their employees start to separate. If they're able to come back together fairly quickly, then we can reestablish these connections relatively easily. But the longer it takes for businesses to get to the point where they can reopen, they're going to find that their employers or their employees maybe have moved on, or maybe their skills have maybe depreciated or changed in some way, and so that's going to be a little bit of a drag on the economy if it takes longer for the recovery to really take hold. So these economic damages that we see basically are just harder to repair the longer it takes for the economy to reopen. All right, things to watch over the next few months. Basically the things that I've already been talking about. Unemployment insurance claims. We think, again, initial claims should continue to taper off. I don't think we're done seeing increases. We may see some increases, hopefully just briefly in those, as maybe certain types of businesses find that they are going to have to close that maybe hadn't had to in the past, or as maybe some of the support that has been provided by Congress starts to and taper off. They may find that they have to start letting go of some of their employees that they've been able to keep on. So we might see initial claims kind of pop back up a little bit, but generally we think it should be tapering off. The thing to really start watching is continued claims. Again, I think there might be a bit of an increase if there is some backlog claims to process. But going forward, I'm starting to look for that decrease in continued claims, because that decrease could signal a couple of things. First, in the short run, what we hope to see is workers returning to work. As we start seeing that, we should start seeing these continued claims start to decline. The other thing, if this lasts for a long time, and I don't think this is really a huge issue, but if the economy were to kind of remain stalled for a more prolonged time, then we could start to see that workers are exhausting their benefits. But this is really more of a longer term issue because unemployment insurance benefits regularly provide 26 weeks. And then with the CARES Act, that's another 13 weeks on top of that. So workers who have just recently found themselves unemployed have quite a few weeks of benefits that they could potentially claim. So again, this is more of a longer term issue. So what I'm hoping to do is watch these continuing claims and maybe start to see them decline. And hopefully that's going to signal that people are returning back to work. The other thing to look at is the national and state jobs reports. These come out every month. One came out this morning at 10 o'clock. And these are really good. They're a little bit lagged because the data that came out today is really focusing on April. But they provide a lot more detail about how employment is changing. And it's more than just the unemployment rate. I'm really watching the number of people who are working or the number of jobs, because these are really better indications of maybe how we're improving. The unemployment rate is a useful rate, but we can actually see the economy improving, and this could cause the unemployment rate to increase as more people start working again, or start searching for work again. And we've seen this in the past, where people dropped out of the labor force and just stopped working because the job prospects were poor. When they started to come back into the labor force because they start seeing the economy improve, the unemployment rate actually went up. And it was because they were on the sideline before, not really counted in the jobs numbers. When they started looking for work, they were counted as unemployed. And what was really happening is they were simply responding to an improving economy. So it's really the employment numbers that I think are particularly useful for seeing how we're performing in the future. So I think that pretty much covers kind of what I can kind of give you, are the slides that I've prepared, and I'd be happy to answer any questions that you might have.
Well, thank you so much, Dr. Clark. This has been just incredibly informative. And for people like me who kind of avoided econ classes in college and don't do numbers very well, you provided such a great overview, and the importance of knowing your numerator and denominator when you're looking at statistics. That makes me feel a little bit more like we're talking like epidemiology and looking at numbers and statistics in that way. So I really appreciate you providing that kind of a user-friendly overview to econ. I think it's been so astonishing for those of us in healthcare who tend to think that, at least in the past, healthcare jobs tend to be somewhat recession-proof, and to see our types of professions like nurse practitioners being without a job. I never thought I'd see the day where that was an issue. And so I think one of the biggest things that we tend to deal with is that loss of control. And what can we do? Is there anything that we can do to help the recovery process or help in some way to try to regain control over that?
Well, I think that's really a question for public health officials as opposed to an economist. As an economist, of course, I'm not really knowledgeable about kind of the public health issues, but we're starting to learn because it's becoming really an important driver of the economy. And so, I think what a lot of people in my profession are really doing is saying, we should listen to our public health experts. They can help guide us through how do we manage this situation safely so that we can return to work. And so I think, as we listen to those experts, help us understand how we can actually go back to work in a way that contains the virus. That is probably the biggest thing that helps our economy. I think probably the worst thing that we can do is if we start ignoring that advice and allow the virus to gain another foothold, or have a second wave of this, that's going to really put significant damage on the economy. It's one thing to try to turn it back, the economy back on now, but a second wave of this would really push off any recovery that we could have. So I think it's really a matter of listening to healthcare experts, public health experts, and understand and really take to heart the guidance that they're providing us.
Okay, thanks so much for that. And I'm going to go ahead and turn it back over to Jerome. I believe he has some questions from other participants.
First question, what impact has the job losses had or will have on the state's Medicare system?
I think it depends on how long these job losses occur. So of course, Medicaid, is a needs-based program, and when we have people working and they're able to get employers-provided health insurance, that's great. Medicaid, of course, provides for people who maybe don't have access to that. As people become separated from their jobs, they may start to lose a lot of those benefits. And I think it's really going to be an issue of how long are these individuals who have lost their jobs going to be without work. A lot of what we're seeing in these claims numbers are from people who really haven't actually lost their job permanently. Maybe their employer has shut down. Some of those are starting to come back, like Ford and Toyota, are starting to come back. Some of those workers are going back to their jobs. They really haven't lost their benefits. They may have lost some income, but they haven't lost their benefits. But for other workers, as their employers maybe are not able to weather this the way large firms maybe can, a lot of those workers may see that they're without income, and so we may start to see that eligibility for Medicaid increase. So I'm expecting that we could potentially see quite a few more people on the rolls of Medicaid. Hard to say exactly how much that's going to be at this point. But certainly, I think it's going to have a significant impact on Medicaid.
Okay. Second question. Are you seeing a difference in the economic impact for rural communities versus more urban communities?
That's a great question. I haven't really looked at that yet. We don't have a whole lot of data at the county level to evaluate that. This week, we just got the jobs numbers for Kentucky, which came out today. I think it's next week or maybe the week after, we should start seeing some county level jobs numbers that'll provide us a better indication of how maybe the rural counties are being affected.
Okay. All right. Earlier, you had a slide up that had the recovery looking more like a V shape. You also spoke about a W shape. How would a U or an L shape affect the economy?
Okay, we got all these letters going on.
Yes.
So let's talk a little bit about what these letters signify. Of course, the V shape is the dramatic decline and a fairly dramatic bounce back or recovery that occurs very quickly. When we talk about a W shape, the idea is that in this context, maybe what happens is that the virus gains another foothold and that we have to start imposing social distancing requirements again. And so, while maybe we start to recover, we saw it drop down, and then, eventually maybe we get a handle on it. In terms of kind of this U shape, the idea is that maybe it takes a while for people to start coming back. I don't think it's likely that we're going to see kind of this prolonged period at the bottom. I think we are going to start to see more of this, a fairly dramatic increase in the third quarter, and hopefully followed by gradual increases, following that. But because we're already starting to see businesses come back, particularly manufacturing businesses, healthcare businesses are starting to come back. I think it's unlikely that we're going to see kind of this U-shaped, unless, again, the behavior of the virus is such that, we have to impose severe social distancing requirements for a prolonged period of time. What I'm starting to hear more anecdotally, so I want to be careful about saying too much about this. But, again, it does seem like some of these offices of physicians and dentists over the past week or so have been starting to come back. And they're hoping to be kind of at full capacity maybe within the next few weeks or maybe a month or so. So if that's true, then I think it's going to look more like a V shape as opposed to having, again, this prolonged period where we're kind of at the bottom of this recession.
Hey, speaking of everyone opening up again, how devastating would a second wave be, and which sectors of the economy are more likely to recover faster from a second wave or slower from a second wave?
So, I'm sorry, can you ask the first question again?
How devastating would a second wave of the virus be?
Yeah, that's a good question. So I think it would be pretty devastating because what it does is it basically pushes back anything that we've done to get the reopening started. So right now we're kind of having these tentative reopenings. People are starting to come back. They want to see more confidence that we're not going to see a spike in cases as we reopen. If we start to see that, I think it really has a significant impact on people's confidence that we can safely come back, that the economy will be able to come back. And so I think, it just kind of has this compounding effect of pushing off spending. People are going to be much more protective of the resources that they've had. I think it's going to have an impact on the further impact on the stock market. And so people's retirement savings maybe are going to decline even more. So I think a second wave would be really challenging for the country. In terms of the sectors that would fare better or worse, I think sectors that are made up of smaller businesses are going to struggle the most in this. They don't have much financial resources. A second wave is going to push that recovery off. It's very likely that those types of businesses would exhaust any financial resources they have to stay in existence. And so, those businesses will probably cease to exist, which will make it harder again for us to get replacements back up for them. It's much easier to reopen a business than to start a new business. I tend to think healthcare is the one that maybe is probably somewhat well positioned, assuming we don't have shortages with PPE. My thinking there is that those consumers seem to their demand seems to be more constant. Again, past recessions, we've not seen employment declines in the healthcare industry. What's happening right now is we're imposing restrictions because of the potential to spread the virus in these types of facilities. So I think as we find that we can do that safely, those businesses are likely to come back relatively quickly.
Okay, last question. How do you foresee the crisis affecting income inequality in the U.S.? Is it going to widen the gap or?
I think it's widening the gap, yes. So an unfortunate issue with this particular downturn is that when you start looking at the sectors that are being affected, they're sectors that typically pay relatively low wages. Retail and leisure and hospitality. Those are two sectors that you have a real hard time adapting by maybe working remotely. It's not like maybe finance and certain types of professional business services where people can pack up their computer, go home and work remotely and without missing a beat. Not to say those sectors aren't hurt either. It's just with leisure, hospitality, and retail, the workers there don't have the ability to perform their jobs remotely. They're being hurt, and they are relatively low wage workers. So it's very likely that this is having a significant impact. Now, one potential bright side associated with those is those are jobs that can potentially come back maybe a little bit quicker in some ways. They may not require as much training as maybe certain types of manufacturing jobs. But I think at least for the time being, this is going to have a significant impact on inequality.
Well, thank you very much, Michael Clark, for presenting, and thank you, Sherry Toll, for moderating today. This is being recorded. If you would like a copy of this recording, you can always email me at jerome.farley@uky.edu. Once again, thank you very much, and everyone be safe out there.
My pleasure. Thank you.
Thank you.